Hello, this is Paul Noble, and this is my presentation on access to mental health care for NURS 384 Behavioral Health Nursing. My first slide is evaluating access to mental health care, which is really the focus of my entire project. This is a multifaceted concern that really is evaluating different issues that are preventing individuals in our society from having access to mental health care. This can come as issue for lack of providers in the area. It can be an issue of cost or of lack of insurance, or within their insurance policy lacking coverage. It can also be an issue of lack of community support, in that mental health care providers in the area are limited, but also healthcare providers in general tend to have stigmas or biases attached to mental health care and the patients that struggle with those mental health challenges. So I chose this topic because I feel like this is a burgeoning topic, that we have a huge wave incoming of clients that are going to be struggling with mental health issues. Depression and anxiety immediately come to mind. It's a predominant concern right now for many youth in our nation, and I feel that making sure that they have adequate access to mental health care will have a dramatic impact on how they live their lives and how well they live their lives in terms of quality and in terms of success, and just being able to live the lives that they desire to live. And so I think it's an important concern and one that we shouldn't shy away from. So when I consider the impact that lack of mental health care access can have on patient outcomes, I think predominantly of things like the stigmas that's attached to mental health, and that specifically the clients that suffer from mental health conditions, and how that stigma can lead to a lack of preventative medical care for patients. And that lack of preventative care can be because patients are complaining of things like pain, and providers are associating that with drug-seeking behavior, and that their concerns aren't taken as seriously as they otherwise would. And it turns out that an individual needed to be seen for some other underlying medical condition that was causing that pain. As an example, so other issues with that, the patients who don't receive mental health care access might not be aware of the fact that they have some sort of mental health concern, and so the lack of that care and the fact that it is affecting their judgment leads them to prolonging time between being seen by a provider, or they don't go when they're supposed to, or they need more support to make sure that they're able to make it to those appointments. And because of that, they have poor outcomes for chronic diseases, things affect them, unfortunately, at a much higher rate that leads to premature death and mortality, because they're not being screened at times when they should be, because they're not going into their appointments. And it's just this domino effect that you can see in these patients' lives that lead to, like I said, unfortunately, premature death, an increase in that. And so that's concern for us as mental health care workers and as healthcare workers in general, that we are breaking this cycle and helping our patients get the best care they can. And this also has huge impacts on patient safety. I briefly discussed some of these things in the previous slide, that the inadequate preventative care is a huge patient safety risk, not just for them, but also for the population at large. When you consider communicable diseases and the need for individuals to receive things like vaccines, and the decreased vaccine rate amongst individuals with mental health diseases, when they're not receiving the support they need, then they miss those appointments that can have a great impact on their health, but also on society's health. We also think about the increased risk of suicide and homicidal ideation that are associated with certain mental health concerns and challenges and conditions. We have those patients with MDD who need to be seen, they need to be treated, they need effective treatment. And when they don't have access to mental health care, then they're at risk of having suicides, of having a decrease in their safety and how they affect other people's lives. There's also that increased risk of mortality that's associated with lack of preventative care. When we think about mental health care workers, if you're going into a client's room to care for them, and because of their lack of mental health care and they're being seen in an outpatient facility or an inpatient, and you're unaware that they have these mental health challenges, you might end up in a violent or in a room with a violent or homicidal patient who has homicidal ideations, and that can be extremely dangerous for you as a healthcare provider, and not knowing that you get blindsided, which we want to prevent. Also, stalking is a huge issue amongst patients with maladaptive coping mechanisms who suffer from mental health disorders. And so when you have that as an issue and you don't or are unable to recognize that in time to set up barriers in your relationship with your patient, that can put you at increased risk. Also, societal safety. These are things that we think about on a much broader scale. Speaking to inadequate preventative care and the idea of vaccinations, but also the risk of joblessness on individuals, and that means a decrease in availability of services through a lack of skilled workers. We also have increased risk of houselessness and the effect that has on society and its safety, in terms of having individuals that are able to maintain a household and pay their taxes and make sure that their lives are not under a constant burden or strain of losing their home because they're struggling with a mental health issue. That's more of a societal issue that or societal safety issue that we should consider when we're talking about mental health care access. Another area of concern, of course, is the financial cost to clients and society. So with client costs, we think of things like out-of-pocket expenses. We think of things like losing their job. Both of those are huge concerns, particularly, the loss of job, because it just is a trickle. It's a downhill effect. You lose your job, and then you can't afford your apartment, you can't afford your medications, you can't afford your health care, you can't afford a great many things. And so that can create a major issue financially for these clients. And they also can't pay that out-of-pocket expense, and it can lead to all sorts of issues as well. Also, societal costs. The loss of a skilled workforce. This is a major concern. If you have workers in the field who are suffering from mental health conditions, but they are unable to get their treatment that they need, then they are less likely to be able to continue in that position as their mental health declines, and it becomes more of an issue for them to maintain that stable work. And because of that, then we end up having individuals who end up going into that downward cycle that I've discussed a few times now. Also, it's a huge burden on the healthcare system that's now seeing a rise in mental health care issues coming into ERs. That they've been ERs and emergency departments in particular have been inundated with clients needing mental health care treatment, but who have been themselves unable to know how to take care of all the people coming in who should be being seen by their PCPs or by a psychiatrist. Instead, they're coming in to the EDs, and that's causing a major drain on emergency services as well as on the hospital healthcare systems as well. Now, as we consider different laws, policies, and insurance company issues that are associated with this, we've seen some great strides forward. Recent changes in the law, the Affordable Care Act, has led to an expansion of care and an expansion of criteria that insurance companies have to require for certain levels of care, including mental health care. The recent adoption of federal policies targeting barriers to healthcare through Healthy People. This is the Healthy People 2030. It's an extension of the U.S. Department of Human Health and Human Services, and it's a deep dive into social determinants of health and how those have impacted patients and how they're continuing to impact patients and the healthcare that they receive. Also in here, we had the insurance companies that I spoke about being required to expand their coverage to include more services for mental health. This is that mental health parity program that was put in place with the Affordable Care Act that is really helping to expand care. But more can be done. We still have a large population that does not have access to these resources. We have a federal poverty limit that is ridiculously a poor reflection of what actual poverty looks like in the U.S. and the cost of healthcare that's associated with those individuals. And there's more that can be done. There's more that can be done to help individuals who are struggling to maintain their health insurance and make sure that their kids and families are well taken care of, as well as themselves. And that definitely should include their mental health. Now, my role in advocating for change, I consider things in kind of a three-pronged perspective: things I can do right here, things that I can do nearby, and things that I can do far away. So in considering things that I can do here right now with my clients, I can assist my clients to find resources to cover the costs of their mental health care. There's programs out there, there's grants, there's resources through HMOs and different programs that they can apply to that can help cover those costs. Also, using accurate diagnosis codes to prevent unnecessary billing. This is kind of one of those little pet peeve things that I know is probably going to drive me nuts. I want to make sure that my clients are only being charged for the coverage that I'm providing and the coverage that I'm responsible for. I don't want them to be getting hit with additional costs that they don't have the money to pay for. When I think about things near, I think about advocating for changes at the state level. This would be to expand coverage for mental health services to individuals in the Medicaid gap that I spoke about. Those are individuals that are at that poverty limit, and we need to see some sort of program put in place to assist them in covering some of these costs so that their access can be restored. For their health, for their mental health. Also, I've considered ideas about joining local city boards that advocate for policy changes to improve community health in my own town. And so some of those different ones that are available even here in Salem, where I'm at, are policy boards that look at the impacts on immigrants, and look at individuals who are from the LGBTQI community that are struggling with different human policies and concerns by the city that they have needs that need to be met and cared for. And I could be a voice at that table to help with mental health and advocate for that. Also, when I think about FAR, I think about advocating for changes in laws and policies on a national level to improve mental health services. This could be through, advocacy programs like those seen with the American Nurses Association, or it could be more if I had a desire to run for a political office, or just make sure that I'm staying in contact with my political not appointees, but my elected officials, and advocating to them the need for them to advocate on our behalf on a national level to see some of these changes. So coming to the end of my presentation here, I have my references page right here. And I think I definitely hit the 5 to 7. Some of these are images though, so hopefully I'm good to go there. But I appreciate your time. Thank you for listening to my presentation, and I hope you have a great rest of your week.